With technological advancements in endoscopic resection and endoscopic imaging, we are now able to perform a variety of minimally invasive surgical procedures through the endoscope. These procedures allow us to resect or remove a portion of precancerous or abnormal tissue and in some cases superficial cancers. The removal of these tissues can be done through the endoscope without any open incisions to the patient. This provides the patient the advantage of a quicker recovery and reduced cost. In the following animation, we describe a technique for the resection or removal of abnormal tissue through the endoscope.
Endoscopic mucosal resection, band and resection technique, is a procedure where a doctor uses an endoscope to remove a superficial flat tumor or other abnormal tissue in the lower esophagus. First, a specialized fluid is injected into the submucosa of the esophageal wall, freeing the tumor from the lower layer of the wall. This allows the doctor to move a cap on the endoscope over the tumor where suction is applied, and the tissue is pulled into the cap, allowing a band to be placed around the tissue and under the tumor, creating an elevated area of tissue. Next, a snare is introduced through the endoscope and placed under the previously placed band. The doctor tightens the snare and the banded tissue is cut off or resected. The resected tissue is placed into and removed with an endoscopic basket. The esophageal wall is left to heal. After which the tissue or specimen is pinned and measured on a surgery board, collecting essential data about the specimen, and the specimen is then sent to the pathology lab for analysis. Endoscopic mucosal resection, lift and free snare technique, is a procedure where the doctor uses a colonoscope to remove a superficial flat tumor or a precancerous polyp in the colon. The technique is also used in the stomach and duodenum. First, a specialized fluid is injected into the submucosa of the colon wall, elevating the tumor or polyp. Next, the doctor introduces a snare through the colonoscope and places it around the elevated tissue. The snare is tightened around the tissue, resecting the tumor or polyp and deep submucosal tissue from the colon wall. The resected tissue is placed into and removed with an endoscopic basket, after which the specimen is pinned and measured on a surgery board, collecting essential data about the specimen, which is sent off to the pathology lab for analysis. Then a biopsy is taken from the periphery of the wound to ensure the surrounding tissue is normal. The clean margins are also ablated or heated to destroy microscopic residue and decrease the chance of tumor or polyp recurrence. At the end of the procedure, endoscopic clips are used to close the wound in the lining of the colon, and the colonoscope is removed from the patient.